Ladies and gentlemen, thank you for standing by, and welcome to Community Health Workers, part of the Solution for Advancing Health Equity, Perspectives and Initiatives from Region 9. During the presentation, all participants will be in a listen-only mode. Afterwards, we will conduct a question and answer session. At that time, if you are dialed in by phone, you may register for a question by pressing 1-4 on your telephone keypad. As well, you may submit questions using the chat feature located in the lower left corner of your screens. If you need to reach an operator at any time, please press *0. As a reminder, this conference is being recorded today, Wednesday, September 3rd, 2014. I would now like to turn the conference over to Shanae Bowie-Onye. Please go ahead.
Good afternoon, everyone. My name is Shanae Bowie-Onye, and I'm the Executive Director of the Healthy Kids and After School Resource Centers in Alameda County with the Office of Education. I transitioned to ACOE in October of 2011 from the County of San Joaquin, the Public Health Services Department, where I was the Program Manager of Health Promotion and Chronic Disease Prevention. I have more than 13 years of experience in public health and program development, implementation, evaluation, research, and health ministry. I'm a member of the Region 9's Health Equity Council for the Office of Minority Health, and I have a doctorate of Public Health in Health Education. This webinar, we will describe strategies, resources, and tools used to promote equity through the community health worker initiatives throughout Region 9. So just as kind of an overview, a community health worker, or CHW, is a frontline public health worker who is a trusted member of and/or has an unusually close understanding of the community that they serve in. This trusting relationship enables the CHW to serve as a liaison between health and social services and the community to facilitate access to services and improve the quality and cultural competence service delivery. A community health worker's unique role facilitates addressing and ultimately reducing health disparities. Now for some key housekeeping points. If you have a question during the webinar, you are welcome to post it in the chat box at the lower left-hand corner of your screen at any time during the actual webinar. These questions will be answered during the Q&A session at the end of today's presentations and the conclusion of the webinar. At that time, you'll be directed to an evaluation survey. And if you would, please take a few minutes to complete the survey, as we would appreciate any feedback you have to help inform future ASTHO webinars. We're also going to include 3 polling questions during this webinar to encourage active participation from all of our participants. I'll do the first polling question now. What would assist most in establishing or sustaining community health worker work in your community or workplace? Please check all that apply. State Department support, funding, federal guidelines for core training, a repository of best or promising practices, or regional depository of community health worker organizations and associations. Giving you a few seconds more to respond. Okay, so it looks like the results are pretty spread across the 5 areas, the top area being funding. And it looks like most of the poll responses have come in. I stopped seeing things change. So just showing the results. The top one, of course, was funding. And then pretty close, but second was state health agency support, and then followed by a repository of promising practices. And then the last 2 were guidelines for training and a repository of agencies or associations. So thank you very much for that. I am pleased to introduce our panel of esteemed speakers. First is Ms. Anna Alonzo, who serves as the Office Chief for Chronic Disease for the Arizona Department of Health Services. Anna oversees the state and federal programs that address diabetes, heart disease, stroke, pulmonary disease, and asthma. Her office also houses the Arizona Healthy Aging Program and the Community Health Workers Program. She has more than 25 years of experience in public health and has held management-level positions at the State of Arizona's Governor's Office, Arizona Healthcare Cost Containment System, the City of Phoenix City Manager's Office, Mountain Park Community Health Center, and the Arizona Academy of Pediatrics. She has developed many strong partnerships within healthcare, academics, public health, social services, and community-based organizations across the region, state, and nation. Anna is a native of Arizona and is passionate about serving those in need. So I'm happy to have her with us today. Our other presenter is Emma Torres. Emma Torres, who's an MSW, is the founder and executive director of Campesinos Sin Fronteras, a grassroots 501c3 community-based organization serving farm workers and their families in Yuma County, Arizona. Ms. Torres has been working as a community representative and farm worker advocate since 1987. A former migrant farm worker herself, Ms. Torres now has over 24 years of public health experience and recently earned her master's degree in social work. She is a pioneer and proponent of the Promotora model as one of the most effective strategies to serve the low-income Hispanic population. She has served numerous local, state, and numerous local, state, and national awards for her work on behalf of the farm worker population, including the OHLT Award, which is the highest recognition award by the Mexican government to people who live outside of the country. I also wanted to point out that ASTHO has a community health worker page, and you'll find resources available for federal Medicare and Medicaid rulings, legislative tracking, and state community health worker programs, and you can see that there on your screen. So now, before we start with our speaker presentation, I wanted to actually go through the webinar objectives and also give a little bit of background on the National Partnership for Action and the Regional Health Equity Councils. So in terms of the objectives, we basically want to highlight the focus on community health workers and the role that they play in helping to address the social determinants of health. We want to talk about a little bit about the history and landscape of the work that's actually happened throughout this region and in our state's territories of Region 9. We want to also discuss recommendations on actually how to build and sustain a regional-based system of support for supporting this work, and then, of course, identify national resources to support the work that's going on in your communities. So just to give a little bit of background on the National Partnership for Action to End Health Disparities, it's a national movement that has a purpose of increasing the effectiveness of programs and mobilizing partners and leaders and other stakeholders with, of course, the ultimate goal of eliminating health disparities. There are 10 regional health councils throughout the nation that have been established to do the following: mobilize regional action around common issues across the nation, leverage federal, regional, state, and local resources, infuse goals and strategies into policy so that things actually can take place in the policy sense at a national level. And then to, of course, support what's going on at the local levels, both state levels and the community level. And then to share success stories around the country, which is one of the reasons for the webinar on today. As you can see, the Health Equity Councils are spread across the nation, and this kind of gives you an idea of where they are and what territories they cover. Just to give you a little bit specifically about Region 9, you have here both the mission for the RHEC in Region 9, which is basically to be effective agents of change to eliminate health disparities. And we want to do that by working with leaders, partners, and policymakers that are specifically within Region 9. And then particularly the subcommittee goal. So within Region 9's RHEC, we actually have a community health worker subcommittee. And the subcommittee goal was to identify solutions that demonstrate the value and impact of community health workers on health disparities, and then to use the documented value to educate, inform policymakers, payers, and other critical audiences about this value. So with that, I would like to present our next polling question. And if you will, what title is most often used in your community to describe community health worker work? And we'll give you a few minutes to complete the poll, or a few seconds rather. So it looks like we have pretty steady results coming in, and with the top result right now being community health worker, and following next in line seem to be community health educator, Promotora, and patient navigator. We'll give you a few more seconds. Looks like we have most responses, and yes, there are your results. So thank you for participating in that poll as well. So with that, we will begin with our first presenter, and I will now turn the webinar over to Ms. Anna Alonso. Anna?
Yes, thank you so much. Hi, this is Anna Alonso. As mentioned, I'm the Office Chief for Chronic Disease for the State of Arizona, Department of Health Services, and I'm truly happy to be speaking to you today about the utilization of community health workers. It's in utilizing them as a strategy to address health equity and promote health, prevent diseases, and assist in navigating the healthcare system. And really, before I get much further into our slides, I really want to acknowledge all of the partners within Arizona who work so closely with the state in implementing community health worker strategies. And there's so many, and Emma you'll be hearing from in just a few minutes. But one in particular is the University of Arizona Prevention Research Center, who we contract with to help support our initiatives across the state. And so we're very strong with our collaborators and partners in utilizing community health workers. So I'm here, and I'm hoping to represent them well in today's conversation. So just to give you a quick overview of our vision within ADHS, specifically our chronic disease office, it's to positively impact the health and well-being of Arizonans by reducing health burdens and cost burdens of chronic disease. And just very quickly, the major goals of our office are to advance policies that address risk factors of chronic disease, identify and eliminate disparities in specific population groups, and the word disparities is very important in our talk today. And we're in the process of implementing our very large CDC, what we call the 1305, or Public Health in Action Grant. And that's the grant that helps fund my office, my staff, and also provides funds for us to be able to implement strategies such as the use of community health workers to lessen diabetes, hypertension, school health, and obesity in Arizona. And we also have within our office what we call Prop 303 dollars, and that's state-funded tobacco tax. And with those funds, we're able to address the 4 leading causes of health, which within Arizona at this point are cancer, heart disease, stroke, and pulmonary disease, with Alzheimer's creeping up very closely, and we assume within the next year or so it will overtake stroke. So with those funds and with our 1305 Public Health in Action funds, those are the funds that we currently have to implement community health worker strategies. And one important fact within the Public Health in Action grant is that we were able to hire our community health worker program manager, Ms. Yanita Soto, who's been with us for about almost 3 months now. And we're very pleased to have her, and it shows our commitment to the strategies of utilizing community health workers within the state. So when we're talking about social determinants of health and the use of community health workers, as you can see, the issues surrounding social determinants of health are health disparities are not decreasing. Socioeconomic, environmental, and cultural barriers continue to impede access to equitable care. Rising health care costs for minority and low-income populations still exist, and more people are experiencing chronic disease, and more specifically are disparate populations. And of course, there's the change in the landscape within the U.S. population. So ensuring that underserved populations receive needed health care, it's a challenge for state and local health departments, health systems, and also policymakers. So we're looking for ways to extend the already strained healthcare system and more effectively reach underserved populations. And this is especially true in health disparities. As mentioned, they're not decreasing. Crucial to addressing social determinants of health is the ability to reach and communicate to underserved and hard-reached populations and improve the quality of information between patient and provider, increase health literacy, and patient capacity to adhere to treatment, and improvements in health-related behaviors. And also we're looking to reach communities with upstream to prevent chronic disease, which is our focus. And what we find, and what we have found in Arizona for many years, is that community health workers are extremely effective in health outcomes, healthcare cost savings, and overall health care access and health promotions. And they act as liaisons between health systems and communities. They facilitate access to and improve the quality and cultural competence of medical care with an emphasis on preventive and primary care. But however, in many states, community health worker programs lack the sustained financial support, and we'll chat about that in just a few minutes. So the community health worker model, they're recognized in the Affordable Care Act as important members of the healthcare workforce, and the utilization of community health workers is one approach to improving the social determinants of health, which is the focus of our talk today. They're extremely effective in health outcomes, improving health outcomes, reducing healthcare cost savings, overall access to health, and promoting prevention and chronic disease management programs. We utilize them quite a bit in Arizona to refer patients to programs such as chronic disease self-management, diabetes self-management education. So in that capacity, they're extremely important. They've demonstrated evidence-based impact in both health outcomes, access to care, cost savings to the healthcare system, including patients with diabetes who attend community health worker education classes and receive ongoing social support, they improve their self-management behavior significantly, lower their blood pressure and glucose levels. And what we find is there's almost a $3 cost savings for every dollar spent for managed health care coordination, and a little over $6 cost savings for every dollar spent in providing self-management education and coordination for diabetes. So as you can see, the use of community health workers is extremely important. So community health workers, as you took the poll earlier, are known by many different names. In our community, you'll hear often the word Promotora. But what we're finding is we have to start utilizing the word Promotores, because there's an increase in men actually participating as community health workers in the community, and that's a good thing. So we can't use the word just Promotora, which is gender specific for women. We have to use the word Promotoras. But you can see the other words, other terms: community health advisor, home visitor, community organizer, health coach, public health aide, community health representative, and so on. And what we find is where you're working often will depend on what term you use. For example, within health systems here in Arizona, some of the large hospitals, they have been using the word navigator. Well, a navigator may often have a different type of responsibility than, say, a promotora, an individual who is directly from the community. And what we're finding within Arizona, especially with the Affordable Care Act in place, is that systems that are not used to using community health workers or promotoras are using terms that a lot of our communities are not used to hearing, such as navigators. For us, navigators often mean navigating people into our Medicaid programs or navigating them into applying for Affordable Care Act. So just keep in mind, in your community, there could be different terms, and you just kind of have to take with a grain of salt as to who's utilizing the term and what they mean. So within Arizona, we have a wonderful coalition that's already in place. It's been in place, for almost a couple years now. It's the Arizona Community Health Worker Outreach Coalition. And within Arizona, this is a definition that we've adopted, and I'm not going to read through it completely for you today, but basically we determined we really need to come up with a definition, because depending on who you're working with, as I just mentioned earlier, it could have a difference in what terms you use, and oftentimes when you're dealing with policymakers, et cetera, they want to see a definition. So we determined that we would use a definition that the American Public Health Association adopted in 2009. So that's the current definition that we're utilizing. So community health worker model in our area, oftentimes the majority of them do not provide clinical care. They complement services delivered through the more formal healthcare network to provide more comprehensive and supportive care. In the area of policy, community health workers engage community members in creating ideas to improve their community. And in the political arena, they can develop relationships and advance a community's policy agenda with entities such as school districts, healthcare systems, etc. Whoops, excuse me. I think I went forward here a little bit too quickly. So in this instance, oh my goodness, I apologize. It's oftentimes depends on where they're working, depends on what type of model you will be utilizing. What we find within Arizona is we try to include community health workers' input into everything that we look to do in developing strategies, policies, etc. So the community health worker role in the healthcare workforce includes trust, rapport, understanding in a cultural manner. They function as a bridge to communicate with the individual and families on their health issues. They improve the individual experience of care, improving the health of their own communities. Oftentimes, they'll reside in the communities where they work or often volunteer, and reducing health disparities and per capita cost of care for population. And once again, working within health systems. And what we're finding is that they're being utilized, they're starting to be utilized more frequently within health systems. And so we're, within Arizona, we're working very closely with those health systems, whether it's a large hospital, whether it's federally qualified community health centers or non-FQHCs, community clinics. So we find it's very important to work hand in hand with these health systems so that they can better learn how to utilize community health workers. So I wanted to present this slide, and this is a slide that Yanitza, our health program manager, community health program manager, found. And I really like this slide because it shows the community health worker as being a bridge. And one of the most important features of programs that engage community health workers is that these women and men strengthen already existing ties with community networks. And this isn't surprising, as CHWs are qualified as connectors to their community, and they generally live, as I mentioned, in the communities where they serve and understand the social context of the community members' lives that they're touching. In addition, they educate healthcare providers and administrators about the community health needs and cultural relevancy of interventions by helping providers and managers of healthcare systems to build their cultural competence and strengthen communication skills. Now, we know this often means that the provider has to be open to learning, and so we're hoping with the use of community health workers that there'll be that, that openness from our providers to learn how to use community health workers and understand how crucial they could be to improving health. So just to give you a short overview of the use of community health workers within Arizona, it actually started way back in the 60s with our tribal communities, and within our tribal communities they're called community health representatives. Then in the 1980s, the University of Arizona began a program in Yuma, which is in the southwestern part of the state, called Un Comienzo Sano, or Healthy Start Promotora program. And this was really the start of a widespread use of CHWs across the state. Then in 1998, there was the first national study of the community health workers by the U of A Rural Health Office. 1999, the Arizona U of A Prevention Research Center conducted a study on the effectiveness of the CHW model. And within the 2000s, we began the Health Start program here within ADHS, which utilizes community health workers. And in 2011, we began actually funding clinics across the state, and we'll touch about this in just a few moments. So we did provide some hypertension system of care grants utilizing CHWs with some of our local health departments. And in 2012, we extended that funding to Wesley Community Health Center, which is located here in Maricopa County, in implementing a community health worker model. And also, as mentioned earlier, we have state health funding, tobacco tax dollars that we utilize to assist and pay our local health departments to implement community health worker models as well. So as mentioned earlier, in 2011, we had a hypertension system of care grant, and this is really the first. Dave Heath, who is our cardiovascular program manager here, actually implemented this in Yuma County with the assistance of the University of Arizona. And I just felt it was important to share models with you all so you can see how CHWs can be utilized and how effective they can be. So the Regional Center for Board of Health participated in this, as well as the Sunset Community Health Center. And just to show you where it's located, if you take a look where it says Baja California Norte and you go up just a little bit, you can see the community of Yuma, Arizona. That's where this project was initiated. Very rural. Most of Arizona is very rural. And the primary objectives were to detail training of community health workers on topics surrounding hypertension and integrate hypertension patient identification, education, and a navigation program at the community health worker level. And what we found is that, I'm just going to move along to the next slide so we don't run out of time. This is the model that we utilized. As you can see, in this case we use the term patient navigator, but it's a circle. As with most health systems, it is circular, and you can see there's a medical home in the middle with the community, the patient navigator, the Promotora, circling and touching every piece of this model, whether it be case management, health education, patient care, and of course showing the evidence-based continuity of care with the use of a primary PCP. And what we found with this particular grant was that it worked. It worked extremely well. There was visibility of CHWs within the clinic setting, and the providers were, most of them were aware of the patient outreach and the education role that the CHWs provided. And most of the concept of a patient navigator at that time was really new to veteran community health workers. So we took them from the community setting and we put them in a clinical setting. And this was one of the first opportunities for us to promote this strategy within the state of Arizona. Oops, looks like there's an extra slide. Sorry about that. Looks like there's some extra slides here. Okay, so the Arizona Community Health Worker Movement currently, we're establishing an advisory board within our office. We're looking at certification and training, and we're continuing to advocate for community health worker workforce within Arizona. And we're providing constant communication between community health worker leadership and our office. So we're including community health worker coalition members as well as members of our 50-plus coalition, AzCHOW coalition members in actually assisting us in how we move forward with what how we're going to further increase the use of community health workers within the state. And we're also modeling other states who have been successful in supporting community health worker workforce, and we're conducting an annual assessment. We will be conducting an annual assessment to measure how and where community health workers are employed in Arizona. I know the University of Arizona has previously conducted such an assessment, so we'll just keep moving forward with that. And as you can see, we have 40-plus members in our coalition. We've identified the definition as we discussed earlier. We've identified a scope of practice for community health workers as well as core competencies. And then we have work groups within our coalition. We are looking at workforce development, definition and awareness, data, credibility, and sustainable financing. So I wanted to share with you what are the scope of practice, what we've identified as the scope of practice. As you can see, there's outreach, community mobilization, home-based support, system navigation, case management and care coordination, health promotion and health coaching, community cultural liaison, and participatory research. So as a coalition, we've already voted on these areas. Then we have our core competencies, we're looking at communication, and which can include listening, use of language confidently and appropriately in written communication, capacity building, which could be looking at an empowerment and the ability to identify problems, resources to help clients solve problems themselves, and leadership, interpersonal skills. So we're looking for informal counseling, relationship building, advocacy, ability to speak up for individuals or communities and withstand intimidation. And for many of our CHWs, that can be a little overwhelming. Knowledge base, we are looking to broaden knowledge about the community, about specific health issues, a knowledge of health and social service systems so they can correctly refer individuals to where they can receive care. Teaching, the ability to share information one-on-one. Service coordination, ability to identify and access resources, and organizational skills, ability to set goals and plan, juggle priorities, and manage time. So these are the core competencies that we're looking at currently. What we're hoping to do with the assistance of our partners is to look at a certification process. ADHS will be the facilitator. Arizona Department of Health Services, will be the facilitator of the certification process. So we're currently in conversations with our partners to see what would a certification process look like. And that's something Yanitza, our Community Health Worker Program Manager, will be taking the lead on. So I just wanted to touch a little bit on the grant, the CDC grant that we currently have, because it's been crucial to us to provide funding for our healthcare community health worker strategies. And so it's basically a combined our separate individual grants that we had for diabetes, obesity, and heart disease and school health, and it's a combined integrated grant. And as a result of this grant, we're able to focus on things such as community health workers, which is a good thing for us because prior to this, we really didn't have any funds to do so. So one of our goals was to hire a community health worker program manager. So we're really extremely glad to have Yanitza on board with us. We're looking at team-based care within health systems. So actually contracting with local health departments to then subcontract with clinics to hire community health workers. We're looking at healthcare extenders to support and self-management. Engage community health workers to support that community clinical linkages. And we also included strategies in our grant and some additional dollars that we received, and another grant that we're applying for, which is a 1422 grant. Anywhere that we can, we're trying to support the use of community health workers wherever possible. We're really trying to leverage. So this is just a couple of examples of what we're doing with our federal dollars. Within the healthcare domains, within Domain 3, which is health systems intervention, we're implementing a community health worker model in one clinic for the management of diabetes and hypertension and to increase referrals. We're now in year 2 of this public health and action grant, and so we are replicating this model into year 2. And then within the community clinical linkages, or Domain 4, we're implementing a community pharmacist medication adherence program, which is working with clinics, community pharmacies across the state to assist them in learning how to better speak to their to the individuals who purchase prescriptions at their pharmacy on how to better use to adhere to pharmacy to their prescription. And then we'll be taking this training on to our community health workers as well, because that's prescription adherence is a huge focus for us right now in Arizona. And then we're continuing to collaborate with the University of Arizona to support the infrastructure and development and training for our community health workers. So this is just a little chart to show you that the money comes from CDC and from other funding sources to us, Department of Health Services, and then we're pushing that money out to our community partners, not only in the community health worker area, but also in other strategies that focuses on diabetes and hypertension. But some of the organizations we're currently contracting with, as mentioned earlier, is the University of Arizona, federally qualified health centers, non-federally qualified health centers, local health departments, and a new strategy that we're getting involved with, which is working with fire departments across the state, and a new movement that's called paramedicine, where they're actually implementing public health strategies out in their areas. And the use of community health workers will be an area that we're looking to assist them. Other states are utilizing these dollars as well. There's 18 states that are doing one or more community health worker interventions with the CDC funds. These three are implementing community health worker interventions. There's Arizona, Michigan, and Nebraska. 5 are doing 2 of the community health worker interventions that are listed within the grant, and the remaining 10 states are doing one or more of the other interventions in domain 3 and 4. And what this is basically telling you is that more and more states are getting on board with CHWs, and it's here to stay. As we mentioned earlier, there's a big return on investment, and we're seeing how community health workers can greatly improve individuals, assist individuals in improving chronic disease in our case, but make it a difference within their communities. So we just wanted to share a little bit what's happening around the nation, and I just mentioned a few of the things that are happening within the state, across the United States, with the use of community health workers. I know the state of Nevada, my colleague there, Monica Morales, is looking to embed community health workers within the FQHCs in Nevada. California is right on board there as well with the use of community health workers. And so is the state of Hawaii. The University of Hawaii, Maui College, has a community health worker program. It's using non-state mandated certification programs they're also in the process of exploring certification and utilization of CHWs as well. So as you can see, from across the country, there's a huge movement. And as mentioned earlier, with health disparities not decreasing, but increasing, we're just continuing to support the use of CHWs. I'm going to leave my information for you, and I don't want to take up more of Emma's time. Emma, I think you have a question before you actually get into your part of the conversation. Is that correct?
Yes, that's correct. Thank you, Anna. Good afternoon. As mentioned, my name is Emma Torres, and I'm in Yuma, Arizona. Before I continue with our presentation, I'm going to move pretty fast because our time is running pretty fast as well. I have the last polling question, and that is that what role does CHWs play in your community or workplace? And it says check all that apply. And it's either outreach, healthcare service education, information, data collection, informal counseling or social support, connection to community services, health insurance, enrollment or education, community advocacy, liaison between community members and providers. So I'm going to give you a couple of seconds so we can get the answers. And I think it looks pretty divided, and I might take that this is probably something that we all see in our community, that promotoras or community health workers take or have different roles within their same occupation, within their same job. So I'm going to go ahead and since Anna did an excellent job in providing an overview of Arizona's community health workers movement since 1980, and even after the community health worker, the CH representatives, and then in the 1980s with the Comienzo Sano in Yuma, I was very fortunate to be one of the pioneers of that model. And I have seen, and it's pretty exciting to see now Anna presenting an overview of what has happened since that 30-some years ago. I didn't want to even mention that it's been 30-some years ago, but I've been working with this model and seeing its effectiveness, and that's why I'm one of the proponents of this model throughout the country. I've been also fortunate to help different individuals implement their programs, and again seeing over and over the impact and the evidence, and now that this has gotten us to where we're at. So I'm going to move on with my presentation, and in particular I'm speaking about the model the campesinos uses. And as you see, I decided to use Sheila, one of our cancer prevention promotoras that is probably one of the best on what she does, and to present, the model that we have in Campesinos Sin Fronteras. I have to put who are promotores de salud or community health workers, because this is what we were told at the very beginning when we started, and now it's a little bit different, and the American Public Health Association definition pretty much fits what we started doing. However, what we started when we started the first Promotora program was that we were called promotores because the model was brought from Latin America, and Dr. Meister brought that model looking into a similar replication here in our farm worker community in Yuma. And after that, we saw that different people were calling their programs even comadres or CHR outreach workers and so forth, but we continue calling them promotores. And we were, and I still do, in order to recruit a promotora, I look for someone that represents the population they serve, culturally, linguistically, educationally, and economically, because they know firsthand and understand the needs of their community they serve. They have that developing a trusting relationship with their clients. They serve as liaisons, intermediaries, and advocates between the health system and their clients. And they go to where their target group works, lives, worships, and plays. And that's the model that we use. And they serve as advocates in accessing healthcare, as we have seen with the ACA. As mentioned, they have to be culturally and linguistically competent to serve those they represent. They build capacity and self-sufficiency among those they serve. They're multitask, multifaceted. They educate, provide informal counseling, social support, and advocacy. Promotoras facilitate access to culturally and linguistic appropriate health care. And they improve the service quality in communities and clinics, as Anna was talking. I'm also part of the Health and Human Service Promotora de Salud Community Health Workers Initiative, and the goal of this initiative has been to recognize the important contributions of promotoras in reaching vulnerable, low-income, and underserved members of Latino, Hispanic, and other minority populations, and promote the increased engagement of promotores to support health education and prevention efforts and access to health insurance. There are 15 members that have been selected throughout the country to represent in this initiative, and most definitely we always talk about as the Promotora or community health worker model. It's expanding throughout the country, the need for better representation or more representation from other states that are not represented in our advisory groups. And as Anna was mentioning, and you all probably know, the Promotora CHW now is an evidence-based model that has been endorsed by the Health Resources and Service Administration the U.S. Mexico Border Health Commission, the Arizona Public Health Association, Centers for Disease Control and Prevention, the National Association of Community Health Centers, National Diabetes Association, Robert Wood Johnson Foundation, the U.S. Health and Human Services, the White House, among many, many others. Last year we got a recognition from President Obama and declaring, I believe, October 13 as the Day of the Community Health Worker. So we even now have a day, a national day to celebrate. And as mentioning before, as in 2009, the U.S. Department of Labor included the Promotora model as an allied healthcare occupation. That was a big win for our efforts in promoting this model because as good as our efforts had always been, we had always had difficulty in being recognized as really an effective part of the healthcare system. And in 2010, it was identified as key part of Affordable Care Act implementation, and then that really got it to where everybody wanted to know a little bit more about who are these promoters, who are these community health workers. And again, that's one of the reasons why we're here. The Promotora model that I use, I employed it in many community and clinical settings. We had started that Promotora, that navigation, clinical navigator with Sunset Community Health Center in 205, something like that. And we had also established pilot projects that demonstrated its effectiveness in management of diabetes care, working with doctors and clinics and with the community, developing support care in the community. So the promoters work in these diverse settings, and they're funded by chronic disease prevention funding. They also were funded, many of them, as through ACA Navigators funding. Their functions are multiple, from Zumba instructors to outreach workers to lay educators. As you can see here, one of our promotoras, Cristina, goes to the fields when the farm workers are having their lunch. She goes, and that's the time that she goes in and starts educating them in whatever area of focus that she's working on. And we work with the whole family. Our promotoras work in the churches and take information there at the schools. Wherever they can find a group that will receive them, they go there. In working with the farm worker population, it's not challenging. What has been challenging is the fact that many people do not understand the lifestyles of farm workers. And we go, our promotoras work non-traditional hours. When I say non-traditional, when I recruit them and hire them, I always say, we don't work an 8 to 5 job. This is not Monday to Friday. This is whenever whenever our community needs our services. So they go to the pickup site where the farm workers are taken to the fields at 4 a.m. in the winter, and they provide them the education while they're waiting there. So that's what I mean non-traditional. Here are our promotoras presenting to the farm workers that are waiting to be taken to the fields. They work, as I was mentioning, we do health fairs, and we work with the clinics and the hospital, and our promotoras are trained and certified to also assist with doing health screening, so they also participate in that. Whenever, in the field, sometimes when there's frost in the letters, they may wait for 4 hours, just waiting to be able to start working, by their field. So our promoters go in and take that opportunity and teach them and provide them information as much as they can at that moment. As I mentioned, we've been working in addressing diabetes with our children and childhood obesity prevention and organizing activities with the whole community to motivate them to get active as well as eat healthier. Those of you that work with promoters, how creative they are. They are creative. They make everything look nice and engage people. Our promotoras at Competencies in Fronteras have a reputation of they can bring any group of anything from 50 to 200 people for their classes if they put themselves to it. So whenever people want together, other groups from outside the state, they want to come and meet with our community, our promotoras are the ones that are pretty much the ones that are able to recruit them to participate. And I'm going to hurry up because I know that our time is really running out. Promotoras use popular learning strategies. We use theater. This is one of our promotoras. You would never tell. She's good. This is about domestic violence, and this is about teen pregnancy prevention. They develop the plays, they practice, they do everything. And these programs also receive funding from the state maternal and child health to provide education for teen pregnancy prevention. We work with the youth a lot, as with any Latino community. There's so many young kids that are always willing to participate. We do community service learning projects that we can engage them at the same time that they participate in improving their community. The support that is key to implement effective Promotora CHW programs is understanding and valuing the work that they do. A lot of people talk about them and they value them, but they don't want to invest or pay for their services. So you have to have a strong administrative buy-in. If your administrators don't understand and don't value the work that promoters do, it's going to be difficult that you establish a strong community health program. You have to be willing to work non-traditional hours with them as well. Provide ongoing cross-training opportunities for the promotores. I don't believe in putting promotores under just one curriculum, because when they're out there in the community, they get asked, they get questions of diverse questions that they're sometimes not trained on answering, so I cross-train them. I include them in organization planning of any community efforts, have ongoing volunteer recruiting strategies to build a strong pool of promotoras for future hiring opportunities. Reimbursement, working with through clinical settings has been a lot easier to get that reimbursement, but most important, we need to pay them. Sources of funding for promotores, as Ana was mentioning, the state of Arizona has been very supportive of our efforts, and not just funding some of our projects, but also promoting recognition and also inviting us to partake in decision making about the public health strategy they're going to implement in our communities. And I think I'm leaving 2 minutes for questions. Shane?
Thank you both for your very informative presentations. So at this time, we'll start the question and answer period. I'm going to turn it over to the operator, who will give instructions on how to ask questions.
Thank you. Ladies and gentlemen, if you're dialed in by phone and would like to ask a question over the phone line, please press 1-4 on your telephone keypad. You'll hear a 3-tone prompt to acknowledge your request. As well, if your question has been answered and you would like to withdraw your registration, please press 1-3. As well, you may submit a question using the chat feature located in the lower left corner of your screens. And we can wait a few moments for the first questions to come in. And just another reminder for everyone, if you do have a question you'd like to ask by phone, please press 1-4 on your telephone keypad, and you may submit questions using the chat feature on the lower left corner of your screens. And our first question comes from the line of Lionel James. Please proceed with your question.
Hello, this is Linnell James. I'm with the Region 5 RHEC, and in the discussion you talked about community health workers and the Affordable Care Act. Could you maybe elaborate, kind of your perspective on how it fits in the Community Care Act and accountable care organizations? Thank you very much.
And will this be for Emma Torres? Will this question be? I
Yeah,
did
let's
mention
start with
about
them.
their participation in the Affordable Care Act because Campesinos Sin Fronteras did receive the Navigator grant. It was a small Navigator grant that allowed us to train 20 of our promotoras and certify them as navigators. And primarily we did this because we are usually the first responders in any situation in our community that people trust to come and ask information on it. And there was so much confusion about what ACA was that we took it upon ourselves to become the trainers and the leaders on our at a community-based level, which that's where I work. And having the promotoras, again, being sensitive culturally, linguistically, and understanding the needs of our population, particularly being in the border community, we have to be very sensitive about the population that we serve. And for us, they were the perfect, messengers to be able to send this in appropriate manner and culturally sensitive.
This is Linnell. There's another part of the Affordable Care Act that actually includes a role for the recognized community health workers to help an accountable care organization in their community outreach to engage community members to be part of an accountable care organization and get the benefit of the care programs unique to an affordable care organization. And it includes an impact on the per member per month charge to the extent that they can demonstrate a community health worker has engaged the community to become part of an ACO. The challenge, as I understand, is that part of the Affordable Care Act involves the states having a formal way to recognize community health workers. And so didn't know if Arizona, since you folks are so far ahead, whether you had a state recognition for community health workers so that they could benefit in the per member per month payments to an accountable care organization. Thanks.
Anna, you want to take that? Let me tell you from my end, I know that there has been discussions about that, but as I don't know, it has been my experience. I don't know if everybody else has this experience, but there is this division between community and clinical. People think that, somehow the community health workers, I don't know if they're not as prepared, they don't have the links with the medical community, that they're not able to be reimbursed. That's why I mentioned that usually in clinical settings and through these accountable care organizations, that's how they're getting some reimbursement. But for the community health workers at community-based levels, it's been very difficult, and it is being hard to be recognized for the impact of their work.
Yes, this is Anna. Can you hear me okay?
Yes.
Yeah.
Okay, sorry. I thought I was on mute. I know it's in Arizona. I know we're just not at that point yet. But we have been looking to work very closely with our Medicaid program here, because at this point they're not recognizing, the CMS, the expansion to actually reimburse for a community health worker participation in providing health care. Within Arizona, we contract with health plans for our Medicaid program, so there is that per member per month piece that actually, having worked for Access before, I understand, but it can be very overwhelming, and to go in and to make a change to our Medicaid program can be very difficult. But we are in conversations with them currently. I can tell you within ADHS, we are looking to work with an ACO in utilizing community health workers, but it would be through federal dollars through our CDC grant to possibly do a pilot with them. Since we've worked with clinics, we're really interested in working with our behavioral health organizations and also with ACOs.
Thank you very much.
You're welcome.
And we currently have no further questions from the phone lines. We can turn it over for any chat question.
So we have a few questions. Being that we are over time, Mina, how much time should we Is there another way to answer the questions that are in the chat box, like through email to those who participated? Can we post? I just want to be
yes, we can answer the questions through and send answers and post them up on ASTHO's website. We can do that since we're out of time.
Right. Okay, so we will definitely work with our meeting co-host to answer the rest of the questions that are in the chat box and then provide information to those who participated in the webinar today as well. So I just wanted to say thank you again for joining us. As was mentioned earlier, you'll be directed to an evaluation, so please take a few minutes to complete that because it's helpful for future projects. And thank you so much also to the Office of Minority Health for sponsoring the webinar, and also to our speakers for their very interesting presentation. And today's webinar has been recorded and will be available on ASTHO's website within the next few weeks at www.astho.org. So we hope that you find the information useful and the webinar as a useful resource. And please share the link with others once it's available. Thank you so much, and enjoy the rest of your day.